email address there as well. But I fascinated to see the level of engagement you achieved from the communities and how you exceeded your recruitment target. So an example, not just of good research technique, but also the importance of involving the community in the process. So well done. Thank you. Um, the last speaker, but not the least, is Ishrat. Sameen, I think we again got some kind of a thing blocking the thing. Yeah. So Ishrat, great CV again. I think um, you trained in you're clinical scientist in the Center for Addiction and Mental Health in Toronto, Canada, and working as assistant professor in the Department of Psychiatry, University of Toronto. Numerous journal articles, membership of editorial boards, but key again research role, including grants from Brain and Behavior Research Foundation, the Stanley Medical Research Institute, and we look forward to hearing your talk now. I think so. Welcome.
Thank you for the introduction, Professor Dave, and thank you for the invitation to today's conference. And I am going to continue my conversation on the theme of parental mental health and shifting the focus a little bit from mums to dads. As Professor Naseem Chowdhury and Farah have spoken to you about psychosocial interventions for maternal depression, I'll be speaking about a program of research that the Pakistan Institute of Living and Learning has developed in collaboration with the University of Manchester and the University of Toronto, looking at a novel psychosocial intervention for depressed fathers in Pakistan. This is called LTP plus dads. And if we could just move on next, I've got no conflicts of interest to declare. You can move next, Samin. So rightfully so, there is a huge focus on maternal depression because of the converging evidence that indicates how it has such a profound impact on child socio-emotional development. However, fathers also have a key role to play, not only in supporting mothers, but also in child development. But globally, depression in fathers is a neglected and under-researched area, particularly in the low and middle income country context. Taking Pakistan as an example, if we look at studies on the prevalence of depression in men, point prevalence rates vary from 23 to 42%, which are significantly higher than the prevalence rates of depression in high-income countries. Now, these aren't accurate estimates because in countries like Pakistan, there are no reliable national mental health surveys as yet. However, it still indicates a huge problem. And there are several reasons that may contribute to this higher prevalence of depression in regions like Pakistan. These include socioeconomic deprivation, employment issues, poverty, lack of education, and also difficulties in access to care and barriers to care, including stigma. Specifically in regions like Pakistan, there's also important to note exposure to traumatic, such as natural disasters. For instance, in recent times, there's been very severe flooding and earthquakes, and also safety issues, all may contribute to higher rates of depression in this area. Specifically with fathers, it's thought that the highest risk for depression is in the 3 to 6 months following the birth of their child. And so it's ripe for an opportunity to develop an intervention for these dads. Next slide, please. So during the research that we were conducting with mums who were depressed in Pakistan, there was a lot of call from the communities that we were working in from fathers requesting access to the learning through play intervention as well. Given this interest, the team at PIL, in collaboration with the University of Manchester and the University of Toronto developed a intervention focus on fathers. It's the Learning Through Play plus Dads intervention. And as Prof. Chowdhury may have mentioned earlier, Learning Through Play is a parenting program that was developed in Toronto, Canada by the Hinks-Delcrest Center. It's focused around a pictorial calendar which is meant for low literacy users. And it really highlights the role of parents' involvement in a child and how it can influence socio-emotional development. It goes through each stage of child development from 0 to 3 years old. And for the purposes of our work in Pakistan, we culturally adapted and translated it. You can see a picture of the calendar there. And also integrated it with the Thinking Healthy program, which is focused on CBT principles. So we developed an integrated intervention that not only addresses parental mental health, but also child development. And for the LTP plus Dads intervention, we really emphasized the importance of the role of the father in the family and in the child's life as well. So the novel aspects of this intervention are the focus on fathers, which, as I said, is a hugely under-researched area. It's a multi-generational intervention, which not only addresses parental mental health and knowledge about child development, but also looks to improve outcomes for child development. And importantly, we are looking to overcome barriers related to stigma. We have framed this program as a training rather than a therapy or a treatment. And we feel this really does overcome barriers related to stigma and access to care in settings like Pakistan. More recently, and due to current circumstances with the pandemic as well, we're really trying to leverage technology and trying to deliver our interventions over mobile platforms, such as Zoom, as we're doing now, but also looking to integrate the intervention into a smartphone application. Next. So our first study using the LTP plus Dads intervention was a feasibility trial of LTP Dads, and this was directly influenced by the call from the community. So we conducted a feasibility study of 18 fathers with children under the age of 3 years old who met criteria for a depressive episode. It was a pre-post study with 12 sessions of LTP plus Dads over 3 months. We conducted our assessments at baseline, month 3 and 6. And we assessed depressive symptoms using the Edinburgh Postnatal Depression Scale, the 17-item Hamilton Scale. We also assessed disability using the BDQ, perceived social support, quality of life, and knowledge and attitudes and practices towards child development. You can see there how valuable the participants felt that this intervention was. The picture at the top there is actually the pictorial calendar, which is put under the thatched ceiling of one of the participants. And really, this is an important picture for us because it really shows how valuable they found this calendar. They kept it up there because they didn't want it to be affected by floods or anything else, and really quite moving. So, and our results indicated that in fact the intervention was feasible and acceptable. If we can go to the next slide, please. So we were able to recruit 100% of eligible participants, and all of the dads attended at least 5 of the 10 sessions. The fathers showed on average an improvement in depressive symptoms, increase in their knowledge, and as well as positive attitudes towards child development. All other outcomes improved as well, including their self-esteem, their perceived social support, and functioning. Next slide, please. So this successful feasibility study led to some seed funding from Grand Challenges Canada, who've been very supportive of our work in parental mental health. They provided funding for a 2-arm randomized control trial of fathers with depression. We were able to randomize 357 participants in Karachi to either the LTP plus intervention or treatment as usual. And this was a 4-month intervention. So we delivered the 12 sessions over 4 months, and assessments were at baseline, the end of the intervention, and at 6 months. Again, assessment of depressive symptoms, anxiety symptoms, quality of life, self-esteem, and knowledge and attitudes about child development. The pictures there just show some of the dads that were involved in the study and some of the group work taking place. Next slide, please. Again, we're very encouraged by these results. We're just preparing this for publication, but the fathers showed a significant improvement in their depressive symptoms compared to treatment as usual at 4 months, with a mean difference in the Hamilton scale of over 5 points, which is of clinical significance. And this improvement was sustained at month 6 as well. Fathers also showed significantly improved quality of life and knowledge and positive attitudes towards child development. So we're very encouraged by these findings and are now looking to scale up this intervention. Sameen, if we could go to the next slide, please. So we are in the process of preparing a funding bid for a scale up of this intervention across the city of Karachi, which is a population of 23 million. This is a very ambitious project, which contains a significant amount of capacity building in the local health workforce. So we're aiming to train 4,000 community health workers in the LTP plus DADS intervention. We're also aiming to recruit almost 3,000 depressed fathers across various villages in Karachi, as well as over 2,000 mums as part of this intervention. Pending approval from Grand Challenges, we hope to start this study next year. I don't know if I have time for any questions.